Good afternoon, everyone. I very much hope our slides are present because I don't know what I'd quite do without them, but hopefully they're all here. It's a real pleasure to be here. It's been an amazing day so far, hearing so many amazing presentations and insights. It's really special to be here with you all. My name is Jack Young. I'm joined by my colleague Owen Thomas. We're both from Vynamic. We're very much acutely aware that we stand between you and some much needed caffeine, or maybe even a glass of red wine that I saw coming out at lunchtime. I had to politely decline that, but maybe after this I'll tuck into one. So we'll make sure that we're succinct and on time. A little bit about Vynamic then. So Vynamic is an Inizio advisory company. We're a management consultancy partner to leading global health organizations. We work across a number of different areas across the healthcare industry. However, probably one of our biggest strengths is product launch. We've completed over 400 product launches in our 20-year history, so hopefully we've got some really interesting perspectives to share with you today in relation to product launch. So today we're going to be sharing with you how to unlock the true potential of successful product launches by embracing the power of authenticity in your engagement with patients. We feel this is not only a beneficial approach, it's a crucial one to elevate your launches to the next level or to elevate them from excellent to exceptional. And in terms of what we're going to be covering today, we're going to first set the scene in terms of some current industry dynamics and why we feel embracing an authentic approach is so critically important. We'll then go on to define authenticity in the context of a product launch and bring this to life using an analogy to hopefully make it stick and resonate. And then we're going to share some practical insights across the different aspects of the launch lifecycle from early development, launch, and post-launch. And then we'll wrap up with some key takeaways. So let's dive in. So why does embracing authenticity matter so much in today's landscape? Well, despite massive strides being made in terms of building trust, in terms of engagements with patients, this has largely been accelerated by the COVID pandemic and a lot of digital technology which we've heard over the last few hours of this morning. There still, unfortunately, are some gaps that remain, and trust is still pretty low within the industry. And some of the stats on the slide here help to illustrate that in terms of a staggering 50% of patients doubt that pharma understands their health needs, and many feel that companies will take advantage. And it stretches not just with patients, but also for healthcare professionals, as less than half, so 45% of HCPs, also feel that pharmaceutical companies don't embody patient centricity at a high level. But it's not just about trust. It also translates into access issues that exist across the industry. The reasons for this are multifaceted. It ranges from marketing authorization challenges, supply chain issues, and also commercial challenges related to pricing and reimbursement. And this is not only bad for the patient because they're going to struggle to get the medications they absolutely desperately need to manage their health, but it's also not great for the pharmaceutical companies as well because it impacts their product success and overall profitability. So whilst this landscape may appear quite bleak, it also presents an opportunity for us to reshape the narrative and emerge as leaders in patient-centric care. And one of the ways in which we feel you can do that most effectively is embracing this power of authenticity in your engagement with patients. So how do we define authenticity in a context for a product launch? And I think this is a really powerful statement. It's putting patients first in an open and sustained engagement to respectfully and compassionately achieve the best experience and outcomes for them. So we heard about compassion earlier. I think it was Hesham's presentation that 2/3 of doctors lack that compassion. So you've got that coming through, but it's really putting that patients first in that respectful way to achieve their outcomes. It's always keeping them front and center in your minds. Recognizing this pivotal role of authenticity and prioritizing the patient is not just a trend, it's a strategic imperative, and it's one that can elevate your launch to the next level. To help you visualize this, I want you to picture the Vitruvian Man. Some of you may be familiar with this. It's an incredibly famous drawing by Leonardo da Vinci, and it represents balance and proportion, and it kind of echoes the equilibrium we seek between engaging patients and prioritizing their needs. I've also got a quote there from Leonardo da Vinci that says, "Knowing is not enough, we must apply. Be willing is not enough, we must do." And the reason why we included that quote is that we feel like a lot of progress has been made in terms of listening to patients, whether that be through patient councils, insight gathering, different technologies. However, there does still remain a bit of a gap in terms of actually acting on what you're hearing, integrating the patient insights into decision-making to drive meaningful change. And we're going to be using this analogy of the Vitruvian Man as we try to bring to life a little bit more this power of putting the patient at the center of what you're trying to achieve. So let me take you through each of these in brief. Human purpose, your heart. So you think about the analogy, you think about the human, the heart. You need to put the patient at the heart of your strategy. It can't just be one slide in a marketing planning brand deck. It has to be the core of what you're trying to achieve, and your purpose needs to be very motivating. And it's not just about what you're launching, it's about the why, and that's critically important. Vision, represented through your eyes. Your vision should be crystal clear. The eyes of the Vitruvian Man represent this long-term ambition to putting patients first, and in that open, sustained engagement I talked about earlier in terms of the definition. And your vision should be more than words. It should be a roadmap that your patients and your employees can see and believe in. Empowering action. Again, using this analogy, you can see the human at the center, symbolizing the patient being at the core of what you're trying to achieve. Patients are more discerning, they're more empowered than ever. They really want to take control of their own health. You need to make sure your launch strategies help enable them to do that. Values, you can feel these in your gut, using the analogy again. These are your behaviors and your commitments. We heard earlier the importance of the leadership, top down, absolutely critically important in terms of the leadership buy-in, but also the different launch teams and the teams within your company all motivated and having some strong beliefs and commitments. Probably one of the most important ones in terms of this analogy we're working through. And lastly, adaptability and flexibility represented through your arms and your legs. Like anything, like any project or any challenge or any launch, you need to be flexible and be able to adapt along the way. The same thing here applies in terms of listening to patient insights and making sure you adapt, continuously listen to patients, continuously listen to them, continuously improve, and make sure you can be agile and make improvements along the way. So to sum up, using this analogy, in essence, applying the Vitruvian Man analogy ensures that a launch strategy puts the patient at the heart of what you're trying to achieve. It guides your vision. It aligns with values. It empowers individuals or patients. And it adapts to ensure lasting success.
So I think Jack's made a pretty compelling case for why putting patients at the center of your product launch is a powerful concept. How do you actually go about implementing that? Well, at Vynamic, the guiding principle that we recommend our clients take is stepping into their patient's shoes, crossing the mirror, as I think Julian alluded to it earlier, and kind of adopting this philosophy of no decision about me without me. No decision about me without me. And we believe you can do this all across the product development lifecycle. In early development, it's all about focusing on truly listening to a diverse range of patient needs and experiences. As we step into the pre-launch phase, it's continuing to build on trust and integrate those insights that we've gathered to deliver with precision and reminding your colleagues that the patient is waiting. I think we heard that today as well. Once the product is in the market, it's about optimizing the patient experience by leveraging digital health solutions, maybe AI, debatable, to drive endurance. Now, this may sound pretty high level, some of it may sound pretty obvious. So what we're going to do is step through each of these phases in turn, talk about the opportunities we see to be more authentic, and then actually how you can action that. So let's start with early development. And on the top right of this slide, you're going to see some quotes from patients that we often see when we're working with clients in this phase of work. And I'm not going to quote them directly, but what you can see is this is about patients wanting holistic treatments, not just things that treat the immediate symptoms that they have. And there's also quite a big diversity, equity, and inclusion element here as well. Patients want to know that treatments are going to work for them, whatever background they're from. So what can we actually do about that? Well, we're seeing leading companies engaging patients right at the start of development, including having them input on clinical trial protocol design. So this is done through engaging patient advocacy groups, individual patients and their caregivers, and it's really ensuring that the full continuum of needs is understood. A simple step that pharma companies can take to do that is by conducting a patient preference study to identify the outcomes that are most important to patients and not just pharma themselves. Another action we're seeing leading pharma companies take is through providing community education, and that's really outreaching to those communities that may be underrepresented typically. That's about building trust with those groups, and once you have that trust, it's about, making the case that participating in clinical trials is really beneficial to that community. In our experience, companies implementing these strategies are seeing improved recruitment and retention rates within their trials, and they're also significantly reducing the burden of those trials on those patients. So let's transition to pre-launch. And pre-launch to us means kind of roughly 3 years out from initial launch or when you commence phase 3 clinical trials. In terms of opportunities for authenticity, again, you can see them on the top right here. It's about understanding the services that are available beyond the treatment itself. And we also hear confusion from patients here. Where do I get my information from? Everybody's telling me something slightly different. I think we've heard that a few times today as well. So what are leading companies doing here? We're seeing leading companies forge partnerships with charities as well as patient advocacy groups. These charities are often seen as the kind of leading source of truth when it comes to sharing information. And so it's really important you forge those relationships early. This is also laying the groundwork for tailored patient support programs, which ensure that kind of seamless two-way flow of information. As you get closer to launch, it's really valuable to have your patient voice front and center in your market access and payer engagement. So we know in Europe now that many countries are actually including the patient voice within their healthcare technology assessment. So the earlier you can engage those groups and have them kind of on your side in those discussions, the better. And finally, we really recommend here taking a look at your internal culture and making sure that your teams are truly focused on patient needs as part of their plans. I think, again, we've heard this today, we're pretty good at focusing on process and technology. I think often the people side gets kind of overlooked. And one kind of really simple pragmatic step we see is starting each team meeting with the patient needs as a reminder through an image or a short patient video or something like that. So finally, into post-launch. And now this is all about kind of that continuous patient engagement and optimizing their experience to kind of sustain the success of your product. And again, let's look at the patient feedback related to this phase. I feel forgotten, right? I'm now prescribed on this medication. I was part of the trial, whatever it was. What's in it for me now? What's available for me now? And patients wanting to take more control of their health. I want you to help me kind of feel more empowered to take control of my health. So again, what can you do about it? Well, we're big believers in this idea of the continuous feedback loop. And the way you drive that is through generating patient-centric real-world data. So this is gathered through kind of the real-world studies that we see, digital devices like wearables, we've probably all got them now. And this is allowing us not only to kind of take care of the safety issues, which are obviously critical, but kind of truly identifying any unmet needs in the patient experience. But even more important than just gathering that data is actually doing something with it. So we're seeing leading companies measuring the impact on patient experience using what we might call kind of more unconventional KPIs. So for example, we're witnessing an increased number of companies tracking quality of life. So this is physical, mental, and emotional well-being, and offers a much more comprehensive view of the kind of value of the product beyond just the clinical efficacy. And here's where AI comes into play, and I hope you didn't think you were going to get through a presentation without a mention of it. So here we go. So our view is, you've got all of this opportunity to gather all of this data. Where we think AI can be valuable is actually helping you then personalize the messaging and the follow-up and the experience with each of these patients. So all of this sounds great for the patient, and it is, but we believe doing this also delivers significant benefits to the business. And so in our experience of working with clients, what we've highlighted here are a few of the kind of big business benefits that we see through adopting this approach. So let's take early development. Companies adopting a patient-centric approach in clinical trials achieve a 40 to 50% improvement in speed to recruitment for their trials. So that's pretty significant. In pre-launch, and again, let's stick with clinical trials. The Economist ran a study in the last few years. I think they looked at 10,000 different clinical trials. They found that trials with patient-centric elements achieved an 87% chance of success. That's versus a 68% chance of success for traditional trials. There's a significant delta there. And finally, let's move into post-launch, and let's focus on some financial figures. So the combination of increased chance of success and improved speed to market, we've seen clients deliver between a 15 to 20 million euro improvement in terms of net present value. So hopefully that's enough to get your kind of finance and commercial colleagues interested in this as well. So I guess the point of this slide is to make the case that it doesn't have to be either or. It doesn't have to be patient or business. We've heard today about those trade-offs. Our view is you can have both, and you get that through adopting a patient-centric approach to your launch.
Thank you, Owen. So this actually takes us towards the end of our presentation. So we're going to wrap up with some key takeaways. Let's revisit that Vitruvian Man analogy that I took you through earlier. I hope it resonated with you. In terms of early development, this should be really focused on understanding, as Owen mentioned. Just think of Leonardo da Vinci when he was doing that drawing. He meticulously studied proportions. He took his time. He focused on comprehensively understanding the patient's needs in those early stages. It's absolutely critically important. Very important not to rush. Let those patient insights shape the very foundation of your launch strategy. Pre-launch. It's all about precision. Again, just as Da Vinci's measurements were incredibly precise, ensure you effectively integrate patient insights. Talked about that earlier with that quote. It's not just about listening. It's not just about having the patient councils or insight gatherings. You have to have a means or a cultural shift, mindset shift, whatever you want to call it, within the organization to make sure that you don't just listen to those insights, you integrate them into the very fabric of your business to drive that change that's urgently needed. Also critically important to build trust with patients. And when you take their insights, go back and re-engage with them and show them how you've done it. They very much appreciate that as well. Post-launch, endurance. Similar to the Vitruvian Man enduring pose, commit to long-term patient support and continuous improvement well after the launch and the drug is on the market. This not only helps drive, enhance the product, but it creates that long-term, enduring and trust-building relationship with the patient. So that takes us to the end of our presentation. As I said at the start, I did promise you that you would get to your drinks break on time, so I think we've achieved that goal. Owen and I and our colleagues will be next door. We'd love to connect with you over the next day and a half or so. I don't know if anyone's going to this happy hour or after party that I saw on the agenda. Dario hasn't really told us much about that, but hope to see some of you over the next day or so. And we'd like to thank you very much for listening.